Hello, my name is Megan, and I'll be presenting on the topic of non-infectious lung issues with a focus on asthma and bronchitis. Okay, so what are non-infectious lung issues? They are non-pathogenic and non-transmittable chronic conditions that affect the airways of the pulmonary tract, meaning that they don't spread through infection or through other people, but are typically caused by unhealthy behaviors or other environmental factors, causing difficulties in breathing and the overall function of the lungs. So now let me talk about the pathophysiology of these lung issues, or the abnormal changes in body functions caused by this condition. Your lungs rely on the natural elasticity of the bronchial tubes and air sacs to force air out of your body. With that said, non-infectious lung issues causes them to lose their elasticity and overexpand, which leaves some air trapped in your lungs when you exhale, leading to the obstruction or inflammation of your lungs. Now, let me talk about the etiology or the causes of these lung issues. Smoking and air pollution are the most common causes of non-infectious lung issues. Over time, exposure to lung irritants like tobacco smoke or chemicals can damage your lungs and airways. Just to see the impact of non-infectious lung issues globally, here is a stat showing the number of deaths that's been caused by this. According to the CDC, last year, in 2022, non-infectious lung issues have affected the lives of 142,342 people, with 42.9 deaths per 100,000 population, causing it to rank 6th in the causes of deaths across the US. With the impact of non-infectious lung issues being so great, it is important to know and be aware of the signs and symptoms of these conditions. Symptoms for non-infectious lung issues often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. But here are some signs and symptoms that you should look out for. Shortness of breath, especially during physical activities, wheezing, chest tightness, a chronic cough that may produce mucus, sputum that may be clear, white, yellow, or greenish, frequent respiratory infections, fatigue or lack of energy, unintended weight loss, which mostly happen in later stages, and then lastly, swelling in ankles, feet or legs. Although these issues are progressive, getting worse over time, they are treatable. With proper management, most people with these lung issues can achieve good symptom control and quality of life, as well as reduced risk of other associated conditions. Now, having gotten a background on non-infectious lung issues, let's expand and look deep into two types of lung conditions that show this: asthma and bronchitis. Asthma is a chronic lung disease that inflames and narrows the airways, making it hard to breathe. The disease affects people of all ages, but most often starts in childhood. People who have asthma may wheeze, cough, feel short of breath, or have chest tightness. On the other hand, bronchitis is an inflammation of the bronchial tubes, the airways that carry air to your lungs. It causes a cough that often brings up mucus as well as shortness of breath, wheezing, and chest tightness. There are two main types of bronchitis, acute and chronic. Now, let's first look into asthma and its overall effects as a non-infectious lung issue. Here is a list of a few common causes of asthma. Asthma is more likely to develop if other family members also have asthma, particularly a close relative such as a parent or sibling. It is also more likely in people who have other allergic conditions such as eczema and rhinitis, which is hay fever. Asthma prevalence is also due to multiple lifestyle factors. Viral respiratory infections in early life can also be a cause of asthma. Exposure to a range of environmental allergens and irritants are also thought to increase the risk of asthma, including indoor and outdoor air pollution, house dust mites, molds, and occupational exposure to chemicals, fumes, or dust. Lastly, children and adults who are overweight or obese are at a greater risk of asthma. While these factors or causes increase a person's risk for developing the disease, there are additional factors such as poverty and lack of health insurance that contribute to more asthma symptoms, emergency room visits, and hospitalizations. Now, having learned the causes of asthma, let's take a look at a list of its common symptoms. A persistent cough, especially at night, wheezing when exhaling, and sometimes when inhaling, shortness of breath or difficulty breathing, sometimes even resting, and then chest tightness, which makes it difficult to breathe deeply. Symptom of asthma can vary from person to person, and sometimes the symptoms can significantly get worse. This is known as an asthma attack. Symptoms are often worse at night or during exercise. Some people will have symptoms when they have a cold or during changes in the weather. Symptoms can be caused by other conditions as well. Although asthma cannot be cured, it can be controlled. Here are a few treatments to help control asthma. The most common treatment is to use an inhaler, which delivers medication directly to the lungs. There are two main types of inhaler: bronchodilators that open the air passages and relieve symptoms, and steroids that reduce inflammation in the air passages, which improves asthma symptoms and reduces the risk of severe asthma attacks and deaths. People with asthma may need to use their inhaler every day. Their treatment will depend on the frequency of the symptoms and the types of inhalers available. Using an inhaler can be difficult, especially for children or during emergency situations. Using a spacer device makes it easier to use aerosol inhaler, which helps the medicine reach the lungs more easily. Along with inhalers, tablets are often prescribed to help control asthma symptoms. LTRAs and theophylline may also be recommended if other treatments are not helping to control your symptoms. It's taken every day to stop your symptoms from occurring. Steroid tablets may be recommended if other treatments are not helping to control your symptoms. They can be taken either as an immediate treatment when you have an asthma attack or every day as a long-term treatment to prevent symptoms. But this is usually only necessary if you have very severe asthma and inhalers that do not control your symptoms. Other treatments like injections, surgery, and therapies are rarely needed, but may be recommended if all other treatments are not helping. Now let's move on to bronchitis. Acute bronchitis is usually caused by viruses, typically the same viruses that cause colds and flu. The most common cause of chronic bronchitis is cigarette smoking. Air pollution and dust or toxic gases in the environment or workplace also contribute to that condition. But here are some factors that increase your risk of bronchitis. People who smoke or who live with a smoker are at higher risk of both acute and chronic bronchitis. Low resistance may result from another acute illness such as cold or from chronic condition that compromises your immune system. Older adults and infants and young children have a greater vulnerability to the infection. Your risk of developing bronchitis is also greater if you work around certain lung irritants such as grains or textiles or are exposed to chemical fumes. Repeated bouts of severe heartburns can irritate your throat and make you more prone to developing bronchitis. Now, having learned the causes of bronchitis, let's take a look at its list of common symptoms. Cough and stuffy nose, slight fever and chills, chest discomfort, shortness of breath with wheezing or whistling sound, production of mucus, sputum, which can be clear, white, yellowish gray, or green in color. Rarely, it may be streaked with blood. And then lastly, fatigue. Since bronchitis is mostly treated as a flu, it's best to instead be aware of preventive actions to avoid bronchitis. The best way to reduce your risk of bronchitis is to avoid getting sick from viruses and other causes of lung irritation. But specific ways to reduce your risk include avoiding cigarette smoke, getting vaccinated, washing your hands, and then wearing a surgical mask. By practicing all of this action, your risk of getting bronchitis will lower, preventing you from being affected by non-infectious lung issues. Now that we have an understanding what non-infectious lung issues are, and its two different types of conditions, asthma and bronchitis, we need to apply this information on the current events that may be affecting these lung issues to happen. With flu season right around the corner, we should be aware of its influence on such lung issues. Viruses like the flu can be hard on the body's immune system. But if you're dealing with a chronic lung condition, a seasonal flu can cause flare-ups and leave you vulnerable to other serious health complications. This is because the flu virus infection of the respiratory tract can trigger an extreme inflammatory response in the body and can lead to sepsis, the body's life-threatening response to an infection. With that, flu also can make chronic medical problems that you already have worse. Next, wildfires. Wildfires are increasing across the country and have been causing the development of lung issues in people. Wildfire smoke is dangerous to patients suffering from chronic airway diseases like asthma and bronchitis, as it results in an increased emergency department visits and hospitalization. This is because wildfire smoke contains inhalable toxic gases and particulate matter that is associated with various detrimental health effects. And then lastly, air pollution. Due to the increase of gas emissions and air pollution nationwide, lung issues have been transpiring all around. Indoor and outdoor air pollution both have strong links to non-infectious lung issues. A person who regularly breathes in air pollution can have a high risk of suffering with chronic respiratory problems. Damage to the lungs can cause COPD and other conditions like asthma and bronchitis to happen, which can make them progress even faster. Now that I have explained how these current issues influence the development of respiratory problems, we have to practice some preventive actions to help lower this risk. Starting with quitting smoking and avoiding exposure to secondhand smoking. As said, smoke from cigarettes can bring about many respiratory issues that progress into chronic conditions, so it's important to avoid it at all costs. Next, staying up to date with vaccinations. With the upcoming flu season, it's important to get vaccines to avoid attracting viruses that can bring about flu symptoms, which can then worsen into chronic respiratory problems like bronchitis. Next, wearing protective equipment when exposed to fumes and chemicals. With polluted air and wildfires, it's important for people to wear face masks or protective gear to prevent exposure to particles and chemicals that can damage our pulmonary tract and bring about various non-infectious lung issues. Next, reducing carbon footprint and being more green. By changing our lifestyle and actions to be more environmental friendly, we can help lessen the gas emissions that goes into our atmosphere, which would help lower numbers of different respiratory issues happening. Lastly, eating a healthy diet and living an active lifestyle. By consuming foods that are nutrient-rich and having regular exercise, our respiratory system strengthens and functions in a much more effective manner. By doing all of these actions, developing non-infectious lung issues will be prevented and lower its overall number of affected victims. So this is the end of our presentation. Thank you for listening.